Good afternoon, everyone, and welcome to the 67th of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at Drexel University in Philadelphia. Today, we have the next in our series of COVID calls in conjunction with the Academy of Natural Sciences, and this is a discussion today about water and COVID-19 with Stephanie Kroll and David Valinsky. You can catch COVID calls live every weekday at 5 p.m. Eastern Time on YouTube. Just go to the COVID calls YouTube channel to watch. You can also hear COVID calls recorded as podcasts anywhere you get podcasts, including podbean.com, Stitcher, iTunes, anywhere else you get podcasts. You can also keep up with COVID calls via Twitter using the handle @US of or @COVID calls. Please do help spread the word and send suggestions for guests and future topics, and please feel free to suggest yourself as a future guest. As of today, June 16th, 2020, there are 8,092,109 confirmed cases globally of COVID-19, according to the Johns Hopkins University Coronavirus Resource Center. That's up from 7,969,003 cases reported yesterday. Of those, 2,127,745 are in the United States, up from 2,105,482 reported yesterday. There are now a total of 116,700 deaths reported in the United States from COVID-19, up from 115,998 reported yesterday. As a way to bring some humanity to the numbers, I've been reading a life story every day, and I'd like to continue that now with a story that was just published. The headline is Representative Ilhan Omar's father dies from complications of COVID-19. This is in the New York Times by Christine Hauser. Representative Ilhan Omar, a Democratic congresswoman from Minnesota, said late Monday that her father had died from complications of COVID-19. It is with tremendous sadness and pain to say goodbye to my father, Nur Omar Mohammed, she said on Twitter. No words can describe what he meant to me and all who knew and loved him. She included a translated Arabic phrase from the Quran, surely we belong to God, and to him shall we return. Her father, who was 67, died in Minneapolis, her office said. She attributed his death to complications from COVID-19, according to an emailed statement. Ms. Omar's mother died when she was 2. And when she was 8, her extended family fled Somalia's civil war and spent 4 years in a refugee camp in Kenya. In 1995, they sought asylum. They sought asylum in the United States, settling first in Arlington, Virginia, and later in Minneapolis, which has a large Somali population. Her father, who was a teacher in Somalia, picked up work driving taxis and later got a job at the post office. Ms. Omar became a citizen in 2000 when she was 17. Ms. Omar, one of the first 2 Muslim women elected to Congress in 2018, has spoken of how her father's words of advice helped her navigate life. When she was bullied at school, he sat me down and he said, listen, these people who are doing all of these things to you, they're not doing something to you because they dislike you. She said in an interview the year she was elected, they are doing something to you because they feel threatened in some way by your existence, she said. At least 30,693 people have tested positive for the coronavirus in Minnesota, and about 1,304 people have died from COVID-19, according to the state health department. At least 116,000 people have died from the disease in the United States. More than 2 million people have been infected. Donald Reed Herring, the oldest brother of Senator Elizabeth Warren of Massachusetts, died of COVID-19 in April. At least 6 other members of Congress have tested positive for the disease, and 40 have quarantined themselves at some point during the coronavirus pandemic. I'd like to turn now to our discussion and introduce our guests for today. I'm really looking forward to this continuation of our Academy talks. They've been really interesting so far. Let me introduce you to Stephanie Kroll first. She's the Project Science Director of the Delaware River Watershed Initiative, a collaboration between over 50 nonprofit groups working in watershed conservation. And she's also Assistant Research Professor in the Drexel University Biodiversity, Earth, and Environmental Science Department, known as BEES. She has a PhD in ecology from SUNY College of Environmental Science and Forestry in Syracuse, New York. She researches the effects of human activities on stream ecosystems with a focus on agricultural best management practices and ecological indicators. The second guest is David Valinsky. David is professor and department head of the Department of Biodiversity, Earth, and Environmental Science, BEES, at Drexel. He's also vice president for Academy Science at the Academy of Natural Sciences at Drexel University. David is currently studying the movement and cycling of carbon, nitrogen, and phosphorus in estuarine and freshwater environments in the mid-Atlantic region. He uses methods of stable isotope biogeochemistry, he's going to have to explain all of this to me, to understand environmental change over time with modern and historic samples. The focus of his work are aspects of water quality and wetland ecosystem services in the Delaware and Barnegat Bays. And both of them have much more that they do, which we can hear about in our conversation today. Stephanie and David, welcome to COVID Calls.
Thank you, Scott.
Thank you.
Well, thanks for making time for this call. I'd like to just start the way I always start the calls, finding out what the situation is where you're calling. So maybe give us a sense where you're calling in from and what's the situation there regarding COVID-19 right now. David, could you start?
Yeah, I'm calling from my office at my condo where I am in Haverford, Pennsylvania. And everything is still pretty closed down around us. And walking around, it's, I'd say 80 to 90% of the people are wearing the mask as they go about whatever they're doing, walking and such. And it's been a long, what has it been? For whatever, it's been many weeks, and it's an interesting ride. I've never experienced anything like this before.
Any protest activity out close to where you are?
There was, I guess, last week at the police station in Ardmore, there was a rally that my daughter and I just happened to, we didn't know about it. We would have gone had we known about it. It was breaking up, but it was, I guess it was early last week. There was a rally out in Ardmore police station. Other than that, there hasn't been many, I carry a sign in my car that my daughter made, Black Lives Matter, just to, as we drive around Lower Merion and, support the whole movement.
Good. Thank you for that update of where you are. Stephanie, same question to you. Where are you calling from and what's the COVID-19 situation there?
Hi, I'm in South Philly. When we looked at the distribution of cases throughout the city, South Philly didn't have as many as maybe other central areas, but I don't think there's any particular reason except it's a very residential area. I live in a row house and it's been pretty quiet, but definitely a lot of people wearing masks. I attended the Center City Black Lives Matter protest last Saturday, which really felt good to be in community. And then there was one on Passyunk Avenue over the weekend as well. There are some not great examples of South Philly protecting the Christopher Columbus statue down in Marconi Park, which my neighbor called Macaroni Park, which seemed not nice either in that way. But so there are some tensions in South Philly about Black Lives Matter and changing statues, so there's not glorifying oppressors. But I'd say most of the community is supportive that I know.
Well, thank you for sharing that. We're all, this is a Philly call, so I would share with you, I've been, I didn't anticipate the Rizzo statue coming down. I thought that was quite something.
That was, I thought it was, I was amazed that it came down so fast as it did, given, what was it, about a year ago, there was a big protest about it and they had planned to move it. And then all of a sudden, boom, it was gone.
Yeah, and the mural, oh, sorry.
Yeah. Oh, I was about to say, all the other statues that are going around the country.
Yeah, and the mural coming down, I mean, I think it's great that a lot of South Philly is Italian, but not all of South Philly is Italian. It's really diverse down here. So I'm glad that they're taking into account the diversity that we represent.
Well, and not all of Italian South Philly, at least when I lived there, was comfortable with the legacy of Rizzo.
Yeah, that's
so it's but it's quite something to see, even in our backyard, that rapid change of both those. Just you reacting to Steph, and I have seen those things on social media. Maybe others have too. The sort of groups that are quote unquote protecting the Columbus statue, and there's a lot of Rizzo fans out there in that regard. But I'm glad we're having these conversations. We absolutely have to have them in every community. And I think in our talk today, even though we're talking about water, we'll be talking about environmental justice. And so just to set that frame a little bit has been crucial in these COVID calls in the last few weeks. Steph, I want to ask you just to give us you work on a lot of things. So tell us a little bit about your science and tell us what it's been like to try to do that in the middle of the worst pandemic that the United States has faced since 1918.
Yeah. So in the project, the Delaware River Watershed Initiative, the main focuses are agricultural runoff, stormwater runoff, and land preservation in areas that are forested. So we're studying the effects of better management practices on the land. And so we have now 6 years of data from the initiative. And the truth is, to narrow what we're doing has allowed us to do a little more data analysis, a little writing up our work. We really enjoy sharing the science with a whole community in non-technical formats. And so we've had more time to talk about why we're doing the science we're doing and to share it with diverse audiences. The bad thing is that, people will go out and talk to farmers and get farmers to adapt their practices to pollute waterways less. So that work has had to go on hold until people can make those contacts. And so thankfully, our funders, the William Penn Foundation, have been really understanding that people should just use the allocated funding for what they can accomplish now. But I do think, and then it's going to be hard for the farmers to be doing their better farming practices. And I'm issuing guidelines for our collaborators to go out and collect samples we collect fish, insects, diatoms, water, to try and do so safely. But we have seen some delays in those, and the timing is important. You should get some insects in the spring before they move from the aquatic to the adult stage. And so some of those sites had to be reduced. And for fish, we have to get those in a window. So we are seeing an impact. I'd say our work isn't so urgent that we're losing a lot. It's unfortunate to not be out everywhere this year, but I think we're really making good use to communicate the science more.
You want to maybe point us to a couple of the organizations that you work with, the more sort of citizen science groups or local groups that are shouldering some of this work when you're not able to get in the field?
The Tucanae Frankford Watershed Partnership, which is the phone call I just got off, they put trees into their Creek Force One van and drove them around to help residents continue planting trees near streams or, in their lawns to help absorb water. But, their outreach for stream cleanings, what they've done is give people kits and recommend people go out with family, since you should never be in a stream by yourself. So they've adapted beautifully, and they're taking donations if you can donate to the TTF Watershed Partnership. And the Wissahickon Friends, which used to be Wissahickon Valley Watershed Association, are also trying to get out and collect samples if they can with family members or housemates. There's a group called Burke's Nature that works closely with the farmers that is putting that on pause. But we also work with, the Nature Conservancy and the different chapters of the Audubon Society. So it's big and small groups are really working to make the work keep moving forward despite staying indoors.
Do you have a sense that you can start new relationships of this type in this digital interface? One thing I've heard people talking about that they're doing, not only your kind of work, but even more social justice work or emergency management work, is that they've been surprised at the strength of relationships, if they already existed, that the technological the distance accomplished mediated through technology has not necessarily kept them from doing their work. but there seemed to be a little more ambiguity around how we go out and form new relationships, new partnerships. Do you have any take on that? It's probably too early to say anything definitive, but I'm curious in this sense because you really do citizen science in this regard.
Yeah. Well, I think one thing that goes in our favor is if you can get your name out there to new people, people are just dying for a connection and connecting much more to the environment. So if you've never been able to get out to a stream cleanup, but somebody sends you a flyer that says, do you want to do this? We're going to give you everything you need. You might take advantage, take your kids out and get out nearby and help clean up. And I think marketing is, if folks can market to new people, I think people are looking for excuses to get out. But yeah, I don't know if that's been effective yet. I know the Academy sent out seeds to our members to help them plant those and try to keep them engaged. But I think it is a challenge for everyday people. It's more of a challenge for engaging new farmers because they do not trust city folks. They are often, many of them are very technologically sophisticated, but I don't know that they're going to necessarily want to get on the phone or on Zoom someone and learn about best farming.
Right. Well, thank you for that introduction to your work about and what it means right now. David, let me come to you. You have many areas of interest, I know, but give us maybe a sense of how your work is changing right now.
Sure. Just first, I want to say the beauties of working at home. I don't know if you can hear the background noise, but they're doing yard work all around me. So there's no way to really stop that at this particular moment in time. It just happened to start at 5 o'clock. Let's put it that way.
They do that here too. Seemingly every day at 5, a crew rolls up. But it is quite fascinating. I've been wanting to, since you mentioned it, to do a show about this. One of your colleagues, Jason Weckstein, ornithologist, we did one of these calls and he identified one of the birds in my yard because he could hear it. It's one of the most extraordinary moments of those whole COVID calls that I've done. It was such a great moment. Anyway, I didn't mean to take you off task there, David, but I thought that was interesting.
That's fine. That's fine. My particular area is a little bit more far field in the sense of I've been looking at how nutrients, nitrogen, phosphorus from the watershed run off into tidal wetlands, tidal freshwater, and tidal salt marshes, and how these wetlands, which sort of act like a sponge, a filter, can remove these nutrients that go into the tidal waters of the Delaware or Barnegat Bay. That's been my focus over the past many years. And how this pandemic, at first I thought, things will quiet down at home and I'll be able to finish the report and write the paper. Well, needless to say, with all the Zoom calls that one could have, and it's gotten to be like a nonstop day of just one Zoom. Usually you have like a half hour in between meetings. Now it's sort of everybody wants to start right on the dot. So the work is slowed down in doing the analysis, but it's slowly but surely trying to finish my last project that I had a year ago to actually understand how nutrients are flowing from the watershed into the wetlands. The work that I see now is that, a good percentage of the nutrients that come out of the watershed are removed by these wetlands through various processes, through various biogeochemical processes. And by that, I mean biological processes, geological processes, and geochemical processes that modify nitrogen, nitrate, or phosphate. So that's what I've been sort of trying to work on over the past many weeks. Thinking at first I'd have a lot of extra time, which doesn't seem to be the case.
You're going into the field?
I have to finish this project in order to start the next one. But no, I'm not going into there's no field work right now. Right, Steph? We're not. We may begin going out in the field, in July, August, but that certainly is dependent on a lot of different factors.
Absolutely.
Do I miss it?
Yeah.
Oh, terribly. I mean, the nicest part of our work, right, Steph, is getting out in the field and just, seeing these processes that we study in action. I think that's, for me, going out to see the transition from a freshwater stream into a tidal freshwater stream, and then as it hits the saltwater, you can actually visually see this change over where we study, maybe 50 yards. You can actually visually see this change on a normal day. And it's kind of, to show that to students, to show that to people who've never thought about it is really it's kind of fun.
I know there are real life and death issues that too many of our fellows in America are facing right now. But I've had these similar discussions with my colleagues in history. They're like, I just am so desperate to get students into the archive.
Yeah.
That we are feeling that, and it's seasonal for academics too, like that certain times of the year, we're used to getting into the space where we do the thing we do with the students and seeing that light, we hope, when we do it right, go off. So that's why I wanted to ask you about that.
And this is our field season.
Right.
This is, we're in it right now. I mean, we're missing the spring season for some of the field work. If the year before, when we were doing field work in my area, we would have missed, March, April, May, and June as that seasonal input.
I want to remind people you're listening to COVID Calls, and you can get questions in. I'm talking to Stephanie Kroll and David Walensky of the Academy of Natural Sciences of Drexel University, and you can get questions in using the YouTube live chat. Just put them right in there, and we can see them, or you can put them up on Twitter if you'd like to, and just be sure to tag @US of Disaster, or you can email them to me. Sometimes people like to do that. sgk23@drexel.edu. I'm monitoring the email while we have this conversation. I want to shift over to applying some of your expertise to the pandemic. And the first thing I want to ask you about, was in the news, a number of different scientific publications were publishing. I'm just going to give a quote from Science Daily that came out in early May. They said the response to the global pandemic is focused on preventing person-to-person transmission. However, experts now believe the virus could also be spread in wastewater. Earlier this week, they reported it emerged that analysis of sewage in the UK could provide important data on the spread of COVID-19. And they warned that the sewerage system itself could pose a transmission risk. So I want to bring that question to you. On the one hand, it's interesting, I guess, as a sort of diagnostic tool for COVID infection, which could be particularly useful in a country like the United States that's done a pretty dismal job at providing testing. But on the other hand, it introduces a whole nother set of concerns that we might have about how the infection spreads. Stephanie, maybe I'll throw this to you first, but maybe either one of you want to talk to this.
Yeah, I think especially, if you work in a building where the toilets are shared, I think that's one of the major ways it could be passed is, if the toilet's not down and things go splashing. But speaking of splashing, it's this time of year where people are getting out into public waterways. So I think the big concerns are, of course, any fecal matter that comes off your body while you're in the waterway, but also combined sewage overflows when our wastewater treatment plants are overwhelmed with rainwater and wastewater coming in. Some of that waste leaves it untreated. It's not a risk with your drinking water because that gets fully chlorinated, but it is a risk of coming into the place like the Wissahickon where people like to go swimming in Devil's Alley. We already had a study, I'm forgetting the last name of the researcher at Temple who is working on this, but there was already exposure to fecal coliforms and other pathogens from our waste there. And now you also add COVID to that. And that's the case for coastal areas that may be receiving wastewater. So it's also, we are now going to talk about more environmental justice, but I think people who can afford to go in a pool and have a private pool may have less of a risk than people who are swimming in public waters. So I think that's the main mode that I'm concerned about. I don't know if you have a different one, David.
Yeah, I mean, just a little bit that I've read is that for at least other coronaviruses, there's really, what I've read is there's been really no transmission in wastewater, that they can detect it, but it's not, it's in low concentrations, you can detect it, but it's, I think an article or a paper that I read from the World Health Organization that is not a known vector for transmission. Is it a completely known? Probably not. I mean, it's always worth studying to see if it can. In the drinking water system, with the way the methods of treating from UV or chemical oxidation, I don't know if it actually moves through the drinking water system.
No, they found it's very susceptible to chloride.
Yeah. So, from the, chlorination processes. It's really interesting to use it as a tool to surveillance to see how communities are if you can make a relationship between how much is detected for how many positive tests you get in an area, that would be kind of neat to see that and try to model that. The problem is, at least in the United States, we haven't really done that great of a job of testing to really try to make those kind of correlations. And then if you were to make that correlation, then it's a question of how you would use that, that type of thing. But it's like, without the right amount of testing, you can only say, oh, we detected, and that's about it right now. That's how I look at it.
Just to follow up from a non-scientist's perspective, but out of interest, do wastewater treatment facilities in the United States have the capacity to do this kind of surveillance? So we're talking about using those kind of facilities to get some kind of a picture that's not available to us at this time of what might be, some picture of the spread of the virus in a place that we might not have a good picture of. Is that possible or not?
I don't think the wastewater treatment facilities like in Philadelphia, they're not, as far as I don't know for sure, but I don't think they're monitoring for COVID-19. Mm-hmm. I think research scientists, and I think there's actually someone at Drexel who's doing a project on this, are doing studies to see whether you can detect it and how far down line can you see it.
I see.
I know that in Syracuse, New York at SUNY Environmental Science and Forestry, they are going to be monitoring the wastewater. So
that was another one, yeah, right.
Maybe the wastewater treatment plants don't have the staff or don't have the interest, but universities, I mean, there's a pipe. So whether or not you work at the wastewater treatment plant, you can find a pipe and grab a sample.
Right, yeah. I see. Yeah. Staying with this topic a little bit and thinking about a different way that the pandemic is affecting wastewater, people, their daily movements have been radically changed in the last several months. So spending all day at work versus spending time at home. Has that had any impact that you're aware of on sort of the wastewater stream, the way wastewater plants work?
Steph,
either of you?
I think that they're probably the municipal wastewater processing in the outlying areas, let's say Lower Marion or Havertown, are probably more people there. There's probably more wastewater coming down the pipe than there is in a normal weekday because people aren't in the city. They're staying at home, eating more at home, less in restaurants, and so on and so forth. So I've imagined the burden is a little bit higher in the other wastewater treatment facilities that you guys in the watershed program may be monitoring around. I would imagine, at least.
Yeah, I know Marie Kurtz, who works with David, and she's the head of our biogeochemistry section, is looking at, since we can't get out, there are continuous monitoring stations by the U.S. Geological Survey. Yeah. And conductivity can be used as a proxy. It's not perfect, but it can be a proxy for urban activities. Just the salt that we eat and that our urine is, salty. And so that her team is looking at that to see if the different gauging stations in and outside of the city show changes from historical patterns. So, but yeah, we could study it more if we could get out.
Yeah.
if you could get out. Right.
Yeah.
So that's, I mean, there's this lag. There's going to be this son of what one of my colleagues earlier called a corona lag. There's this time lag. It's sort of like all these great questions in science that needs to be done that's going to have to come later in the year, we hope. You're going to have to work awfully fast when the green comes before the next yellow comes. I'm sure you're feeling that pressure.
Yeah. One thing that's interesting with the virus and the, let's say, most probably immediate shutdown of the United States or of various countries that we've seen, as we've seen as you can, is the response to environmental change that has occurred after maybe a month of shutdown, a month and a half. They've seen it in lake quality in India. They've seen it in Venice, the Venice canals. They've seen it in reduction of CO2 emissions. And the question I have is, how can a scientist use that cause and effect in a modeling framework to understand the turning, how can you understand that in the sense of, if we start to make some environmental progress, what kind of response, we can see what kind of response we'll have, right? Yeah, you shut down everything, you're gonna be able, from pictures from India, you could see the Himalayas, where 2 months ago or a year ago, you wouldn't be able to even see it. That we have data now that can show sort of that response time. It's not a gradual shutdown, but it's been a very relatively quick shutdown. And I would get a sense, Steph, that you might be able to see things in the water quality as soon as you guys can get out.
Yeah, I mean, I'm not sure about that. I've thought about it, and I think a lot of the lakes and the places where they're seeing it healthier is where there were a lot of boats or like specific human activities that really impacted those waterways in a negative way. So I've been trying to think about, are there such things in the rivers of the Delaware Basin? We don't have a heavy like recreational boating industry, as far as I know, in our reservoirs. So yeah, I think it's definitely worth thinking about. But as you're saying, I think it is going to be a great model when we think about mitigating climate change. And I think you brought this up yesterday, David, and in my work, where I want to see how quickly streams might respond to improved agricultural practices, it at least gives us a little bit of hope in some short-term changes, and hopefully, more theory to work off of on that.
Yeah, I mean, the idea that you can make a process change and improve the environment, people can see that. I mean, it's obvious. I mean, anybody looking at the environment can, if they want to, can notice that there has been a change. Will it persist? That's, I'm not going to go down the political route just yet.
Well, let's do that, or let's go next to that, because I want to stay with this for a minute, because I had a talk with Franco Montalto, who's our colleague in the Department of Civil, Architectural, and Environmental Engineering at Drexel, and he was observing. So he's an extraordinary leader in urban environmental change and climate change, and he was observing how despondent people really felt, and I think I felt the same through these last couple of years. The United States pulling out of the Paris Accords, the COP meetings being sort of overtaken with this sort of just total fatalism, particularly because Brazil and Australia and the United States sort of one after another saying, not just we're pulling out, but like, we don't care. And then, within a couple of months, you have a good share of the world's population, those who can avoid going to work, at home, following the advice of scientists. And of course, no one would, by any stretch of the imagination, say we should inflict a pandemic on the world as an experiment to see what we can do about climate change. And yet, here we have this demonstration. And it's valuable, right? I mean, we learn things in this moment about the pro-social abilities of humans to come together around a threat. And I wanted to just sort of bring that back. I mean, you could pick up the political side of that or just your own observations of that as a scientist, but he has lingered on that point as being a really crucial one that we shouldn't forget in this time.
Yeah, I think that is really huge, that communication of change. And like you said, people, some of them following scientists' suggestions, and the evidence now shows that those who did follow the scientists' recommendations, those countries and cities and towns and states are doing better with lower infection rates. And I'd also say, again, you know, everyone's been cooped up with not much to do. So getting outdoors, I know Jason Weckstein mentioned how people are saying, is it normal to see this many dead birds? And he said, yes, it's just that you haven't seen them before. And, you know, this happened right in the spring. So that for me, at least, the cherry trees and becoming spring really felt like a miracle because we don't have so much going on. So it just really felt like, oh, that is what I need right now, is to see nature continuing forward while my life is interrupted by this. So yeah, I hope it really does connect people more to science and to nature in the future.
And understanding that scientists, you know, Fauci and the others, that we can be believable. I mean, you get the political rhetoric that you can't believe anybody other than he who says it best, of course. But the scientists are, you know, have something to say in their belief, and you can see the believability of it with the virus and how, you know, we're getting the right information. It's just making sure we can act on it. And couple points to this is that where I was going to go, that with the environmental laws potentially changing with the spin up of the economy, that's going to have a very big effect on how we manage what we have a year from now, 2 years from now, you know, possibly. I don't know how it will phase out. But this also is an opportunity that, since there's a lot of people out of jobs, and I'm not going to go down, I'll mention the FDR approach, is that there are ways that you can use the workforce to help build better environmental systems right now, be it solar panel farms, be it helping with the electrical grid and networking that way. But we have an opportunity to help improve our environment, you know, at this point. We're not going to do it. I don't think that's going to happen. Maybe I'm being too fatalistic. But we do have that kind of opportunity. If we let it go, then 2 months, 3 months, a year from now, we'll still see the same kind of problems we're seeing now in the environment. And on the other note, I do my walks at 6 o'clock in the morning for 45 minutes, and I'm seeing so many foxes and rabbits. I just, you know, never noticed them before, but they're out there. They're out there. This is in Lower Merion.
There must be a connection, and what I'm about to say is totally unscientific, but it feels intuitively right, that the more people are exposed to biodiversity, the more likely it is that they connect with the importance of biodiversity, and that somehow that can be a platform upon which to achieve political aims. And I wonder about that, and I wonder about connecting also, David, you know, you're sort of describing something that others have explained as a Green New Deal, or something akin to a Green New Deal that can come out of this moment. So rather than taking the one approach, which unfortunately the EPA early said, we free petrochemical plants from all sorts of air quality regulations because this is a moment of national concern, fine. But there's a possible other outcome of this, which is that, and I don't think it has to only be Democrats, frankly, but it's more likely if there's a Democratic president, that this coming out of this moment would be a rethink about environmental policies, but also taking this opportunity, if you're going to rebuild the economy, rebuild it in a more sustainable way.
Yeah.
Yeah. Sorry.
Go ahead, Steph.
Go ahead.
Just thinking about also, you know, I've been reading a lot, seeing a lot of social media posts about, you know, climate justice is environmental justice, is racial justice. So bring this environmental maybe momentum that we have together with Black Lives Matter and related issues taking precedence. Yeah, I really hope, funders are shifting to COVID, and maybe after that they will also think about shifting to climate justice and environmental justice, and really getting the workforce in there to people who want to represent their communities and improve them, and who want to represent nearby communities and do the work to really get the environment serving everybody and not just privileged.
Steph, can I stay with that for a minute? Because I wanted to ask both of you this question about where, your own interests in water and water quality, where they intersect with environmental justice concerns. And I totally am very interested in the way you're broadening this out to even talk about justice more generally as something that we shouldn't just divide it from the criminal justice system and our environment and our healthcare system, but that somehow we should be looking for the continuities across at this time. Could you give us some examples about how you think about that, or places where you see environmental injustice when it comes to water in America today?
Yeah, I think it's hard not to bring up Flint. You even mentioned, Scott, that they're still drinking bottled water. I have put in a grant proposal, hopefully it gets funded, to really look at all the sources of lead in Philadelphia and people's awareness of their exposure to it. And it isn't just through water. In Philly, we have fewer exposures to lead through water than we do through air, soil, and household dust, for example. But it doesn't mean that it's not a problem. At the same time, most people can drink their tap water, even if you have a lead service line, if you run the water for 3 minutes. I know that means that you pay for running the water for 3 minutes every time, part of an issue. But I think there is still, because of Flint, even though the Philadelphia Water Department has done a lot of outreach, a lot of education about, and a lot of testing of people's water, there's still a lot of doubt about it. And so therefore, people with lower incomes are the ones spending more on bottled water. So I'll just say, I'm a maniac about bottled water. I will go thirsty before I buy a plastic bottle of water. If I can find, boxed water, I'll drink that, or I'll just stick my mouth under a sink somewhere. But I'm a real fanatic about that because of the plastic pollution, the privatization of our water resources, which should belong to everybody and not ever be sold. And also, just that it costs money and it takes away from our tap. So those are where I really think about environmental justice and drinking water and the way it's served to people and the way it's marketed to people.
Mm-hmm. Yeah, and it does have a direct COVID implications on health outcomes. People of color live, near a lot of these polluted sites that have higher levels of, bigger problems with air quality, causing more asthma, more, problems with, once you have that, that's a cascade, especially when you get the virus, you can have worse health outcomes. And we've seen that in New York, we've seen it in Philadelphia and other places. And that environmental justice side is that the resources to clean up facilities is not necessarily in places that have the most pollution. And that I've seen that a lot of my initial work was down in Potomac on the Schuylkill River, not in Schuylkill, on the Anacostia River, which is similar to the Schuylkill. And, the money goes on the upstream of the Potomac, not on the Anacostia. It goes on the upstream of the Delaware and maybe not on the Schuylkill River. Things change, but it's still, that's an issue to be dealt with. And when you have, the communities living right near the old refinery, thank God that's not going to be as a refinery in the future. The health outcomes relative to these kind of pandemics can be worse. So it all sort of plays together. And then when you get into financial side, it raises all the financial costs because of the healthcare outcomes. So it sort of cascades a little bit.
It's fascinating to me that we try to disentangle these things. We look at how our environmental policies are spread across multiple different jurisdictions, but we really should be thinking about cross-cutting. And water is the ultimate example of a cross-cutting concern in America, right?
Yeah. Yeah. I'm from Syracuse, New York. I lived in Spain and then I moved to Philadelphia. So I don't know the names of the towns or the municipalities. I know where the rivers are and maybe which roads get me there. But right. We've seen for stormwater management a lot of collaboration. The Wissahickon is a great example, where people cannot be developing more hard surfaces in their homes because it will affect stormwater downstream. And so, yeah, I really hope that water sort of continues to bring us together. But even that sort of collaboration is not that old on local levels. The Delaware watershed is governed by crosses 4 states with a little dip into Maryland, and those governors, developed policies together. So it really does necessitate collaboration, but is it at the level we need? I think you're saying, and I agree, it's still not quite there. We still have a lot of heavy contamination and alteration of streams in urban areas, and then out in the country where you have a higher percentage of white people living, you have much healthier streams. So even just recreating in streams and your perception of a stream and your water is much different if you're living in a city, and especially, a post-industrial area.
Mm-hmm.
Yeah, I'm sure, Steph, you've seen a lot of this in your travels through the watershed.
So I want to remind everybody you're listening to COVID Calls, and we're talking with David Walensky and Stephanie Kroll, and you can get your questions in via the YouTube live chat, or you can get them up on Twitter if you want to. Just tag at US of Disaster. David, I don't know if you were intentionally coining a new phrase for scientists, but I'll read it back to you. You said, "Scientists, we can be believable too." Or maybe slightly paraphrasing, but that's what I heard. And I like the humble, it's a very humble statement. But it does speak again to come back to this issue of speaking in this time. And the reticence that maybe sometimes people have to speak to issues outside of their own specific subject area. And I think this is, so I'm thinking about, right now we've had a lot of epidemiologists appear all of a sudden in America who seemingly don't have any epidemiology training, but they feel comfortable coming out and talking about public health. So that's a concern. But on the other hand, I worry about experts who don't speak from their experience in this time. And I want to bring it back to science and think with you both a little bit about how you feel, even as advocates, sort of science communicators, as teachers. You must be feeling extra pressure in this moment. I just want to get your sense of it because, as a historian, I've been called on a lot in the last few months to tell us everything you know about, what we should learn from history at this time. It's not always that neat and tidy. So history doesn't give you a clear playbook on what we should be doing in this moment. It does tell us we should attend to vulnerable populations because we can say that in disasters, they tend to get hurt more. But history doesn't always tee up clear answers. I wonder if you've been called on, well, I'm calling you right now, I guess, to be fair, but if others have called on you to sort of reflect on your role as an advocate, as a science communicator.
Steph, you want to take, or
you can go? I've been going.
It's your quote, David.
No, I know. I'm trying to. I think it's important for scientists to speak to their science. What I'm doing, for instance, or what Steph's doing in water quality, and tidal marshes and maintaining them, looking at processes they're in, but also that a lot of these issues this pandemic there's a big component of science to this. And to be able to filter out for some of our friends and family and colleagues who aren't in the sciences, how to look at a scientific paper and how to judge what's, scientist is an iterative process. You do a research, you publish it, and it's peer reviewed by colleagues in the field, but it's also has to be repeatable, reproducible. So scientists go back and try it and see if it works, and it builds upon itself. We lose some of that in the quickness to get things out, especially in the pandemic side, to get things so quickly out. They still aren't, they may be past the test of a peer review, but they're not yet proven reproducible. And you try to do that within the study, but then other scientists need to follow the methods and say, all right, hey, this does work. And it's up to us as scientists to help give that uncertainty plus some assurity to our colleagues, our family. I look at our families and friends, that there is a process that can work for us. And it's not, it's not just in the political world. It is, there's actual things behind this that Fauci's going with, that other epidemiologists, I mean, the New York Times had a survey of like 500 epidemiologists. Would you send your kids back to school? I thought that was kind of informative, to tell you the truth. But it's sort of we need to speak up and be part of the process.
Steph, what do you think?
Yeah, I really agree with David. I think sometimes I get a little saturated reading about everything that's going on, but yeah, it is disheartening. I think one of the studies showing that Advil might be problematic was shown to be not as rigorous as they had thought. And I guess I happened to be visiting my parents, and my father listens to Rush Limbaugh. And as I walked through the garage, I heard, the thing you need to know about science is it's corrupt. And I think that really, no matter what we say, encouraging people to expose themselves to diverse news sources, and also just check who is interpreting the science for them, because that's how it's going to reach them. I think, David, I wish people would read more studies, but they're also behind a paywall half the time. So, Science Daily that you cited, Scott, is very prolific. And so just encouraging people to try to get from a source that does interpret the science properly, or at least tries, and to give it a chance instead of just listening to somebody who says, scientists have their own agenda. And I'm like, are we lining our pockets though? And just trying to remind people. I know.
Yeah.
So I think that is the missing piece, is who's communicating it.
Yeah.
Let me stay with this for a minute, because I want to think about teaching at this time and about your students at this time. I have great optimism, but also great concern in this moment. In part, I feel like the students I've interacted with in the last 3 months, they know the gravity of this time. We don't have to explain to them. I mean, their whole lives. I mean, they were born in 9/11, going to kindergarten during Katrina. They were in elementary school during the financial crisis. They've endured lockdowns in their schools, and this to happen now. They know what life in disaster is like. And so there's a gravity, I think, probably that they feel. But I sometimes worry that it's so much to ask people to be experts in the subject area and also professional communicators. But it seems like that's what we're almost need to have young scientists doing and training for. I don't know, maybe my own sort of personal thing, and I don't even know how you structure something like that. There's only so many hours in the curriculum and only so many hours in the day. But then I look at Greta and I see a young person who has communicated the moral imperative of paying attention to climate change so incredibly effectively. And I think that's resonating with young people around the world.
Yeah, I think in my project, since we do communicate a lot with non-technical audiences, when we have students, they're helping us do a literature search for a paper, but we are trying to give them some exposure to ways of communicating. So one of our earliest interns, who still works for us now, Amanda Chan, is really contributing a lot to our Twitter feed and some of our social media presence because A, she has more patience for Twitter than I do, but B, she is a great communicator. She really sees through the jargon and finds ways to describe these things to her peers who may be in other majors or different ages. So I do think, yeah, that college age when you were in college, you were like, oh, I'm never going to change. I'm always going to be this open-minded. And then life goes on and you grow into a niche. I think they are a great age to really ground us in the problems at hand and really bring perspective of the communities they live in. I'm collaborating with a couple of people in their 20s and, I'm 40. I'm not ancient, but I still see so much more in their consideration of the world in different areas where I wouldn't have gone. So I think you're right. They are natural communicators, many of them, because of social media. If we can bring that love of science, I think you're right that it's important, and hopefully they'll do a better job than many scientists now who hide behind the peer review.
Yeah. And it's something. I have a faculty member who's teaching a class in the department, just finished up, Environment in the News. And it's a class in which they go over present day environmental, articles and how to review them, how to look at them, how to understand them, and the communication method. And I guess it's a mixed thought. It's a saying that I've heard, and I'm not going to go where, but it's, you save one life, you save the world. And this professor got an email from one of the students that she finally got to understand how to look at news articles, how to critically evaluate, in their own mind. I mean, this might have been a Westfall design student, how to evaluate some of these things in the newspaper article to get a better sense of how real the article is. Be it the New York Times or the Science, whatever. I think Amanda used mostly the New York Times, but to me that was such an encouraging email that I saw from that student. That here's one student that gets the criticality of looking at science and trying to understand it for the betterment of herself and the betterment of our environment. And I think that's important.
I think it's important too. We're almost up on time. Still okay to get a comment in if anybody wants to, or get a question in. We're facing months now of uncertainty to come about what's going to happen with schools at every level going into the fall. And I have a quite specific question about that, coming back to our earlier question about trash in the waste stream and in the water potentially. I mean, we have a lot of PPE, gowns, masks, gloves, whatnot, that are, I'm sure, filling up landfills. I see them. I've been doing these early morning runs, just like you were talking about, David.
Same with me. You see
random
the PPE,
and I know somebody good was out for a run and couldn't take it anymore and threw it off. Whatever it was, it's everywhere. And now we're potentially, I think it will be a marker of very important responsible behavior that people are going to use a lot of PPE in the coming months. What are your concerns, Stephanie? I'll start with you about that and water, and maybe is there anything we can do about that? I mean, it comes back to, again, some kind of messaging problem or communicating to people like this is going to end up in the bay if you don't dispose of it properly. I don't know. What's on your mind about those kind of issues?
Yeah, I do really worry about, that trash, which now it's gloves, but it used to be water bottles and chip bags maybe. So yeah. I think that is an interesting question of how is the amount and the type of waste running off into streams, litter, changing. I also think I was talking to someone whose partner is in healthcare, and they just reminded me that if you just wear plastic gloves all day, that's not accomplishing anything because you're going to touch your face with the gloves on. So you've just contaminated them. So I think, wearing reusable masks, reusable gloves, and washing them is still a good alternative to the disposable ones if you're not working in healthcare, you know, and hopefully, I don't know, I would love if somebody could come up, well, to widespread use those mushrooms we've been reading about that can decompose plastic, or recycle gloves in some way. But yeah, it really does concern me because they get broken up in small pieces, and that's when they're most damaging to wildlife nearby, you know, snapping turtles and fish that people are, you know, trout that people are eating. Or, you know, we hate to see that sea turtles with their stomachs full. And then now I just saw an article that microplastics are raining down atmospherically. So
Right.
where we used to see mercury being deposited through the atmosphere, now the plastics are. So yeah, I think it is making that problem worse. Anything people can do to wash their hands and use hand sanitizer instead of gloves. And if you have to use gloves, maybe you can buy a few pairs of clown gloves or something.
Mm-hmm.
You know, buy a mask from your neighbor who's sewing more because she has more free time.
Yeah, yeah. I mean, the original things that I read is that, you know, the transmission could be on surfaces. So people thought of wearing gloves, and now it's being less thought of that way. But that's sort of that iterative process. I mean, people were thinking more health than they were of the trash. Hopefully that is being shifted. I mean, I'm with you, Scott. I do my walks and I see the masks now, you know, on the sidewalks, people just tossing them off. Not a good thing. And it's going to be a marker of this. Could it be a marker of this pandemic 1,000 years from now? You know, I don't know. I'm not going to get into
that's what I was just, we've all talked before about the Anthropocene, and I was thinking there's going to be this like PPE micro layer in the Anthropocene.
Yeah, right. And say, oh, that's when the great pandemic of 2020 occurred. You know, who knows? Who knows?
Absolutely. Well, let's hope it's not a very thick layer.
No. I hope not either. You know, I'm just not hopeful that there won't be a second wave of this in the fall. And a little bit that I have read on the history is that most of the pandemics usually have a second wave that's worse than the first. So we'll see.
So
I think we're, go ahead.
I just hope those scientists keep going that are developing the vaccine. Keep going, scientists.
That's right.
The vaccine.
Yeah.
I agree, and I would say the same back to both of you. Keep, pace yourselves and keep doing what you're doing. I think this is going to be a long process, and it's going to have ups and downs, and people need to support each other, and scientists need to support each other, and the public needs to support science.
Yeah.
Thank you so much to both of you for your time today. Really illuminating conversation.
Quite welcome. It's a
Thank
pleasure.
you. It's great.
You've been listening to COVID Calls and my discussion with Stephanie Kroll and David Walensky from the Academy of Natural Sciences, and we will continue these weekly COVID Calls Academy Talks next week on Tuesday, and you can listen to COVID Calls every weekday at 5 p.m. Eastern Time. Stay healthy, everyone. We look forward to talking to you tomorrow. Thanks, David. Thanks, Steph.
Thank you.
Bye-bye.